أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وصلى الله على سيدنا محمد وآله الطاهرين اللهم صل على محمد وآل محمد. قال الله تعالى في القرآن المجيد بعد أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وأن تصوموا خير لكم إن كنتم تعلمون. We are coming your way this afternoon to deliberate on some few issues about the benefit of Ramadan fasting. If you look at the verse I quoted, it is towards the end of Quran chapter 2, verse 184, where Allah made fasting obligatory on us. And then towards the end of the verse, he says that you should fast, for in this fasting is a lot of good for us if only we knew. So this afternoon we want to look at some of the medical benefits that we get from fasting and some of the other issues that usually within this month a lot of people do ask about. So we'll be looking at some of the common medical conditions that fasting can impact on. So we have something like hypertension, diabetes, ulcer, and in fact the immune system of the human being, and what has been found through research that fasting does to these systems. So one of the key things about fasting is that it reduces, if you engage in it properly, it reduces your cholesterol level. There are several types of cholesterol, but one of the cholesterols that is detrimental to our health is called the LDL cholesterol. That's the low density cholesterol. And from research in those who have been fasting, it is known that this bad cholesterol reduces a lot when you engage in the fasting in fasting in Ramadan. And it is this kind of cholesterol actually that when it is high in your system leads to a lot of complications. So it will lead to hypertension, it can lead to strokes, it can lead to a lot of cardiovascular problems. When I say cardiovascular problems, problems that has to do with your heart and your blood vessels. The reason being that it's a form of garbage, let me put it that way, that deposits in your blood vessels. And once it deposits in your blood vessels, it makes the lumen of your blood vessels very narrow, so that you are not able to, blood is not able to flow very well. So it affects the organs that these blood vessels are supplying. So in other words, someone who has high cholesterol in their system can get high blood pressure, they can get kidney diseases, they can get strokes, they can get heart attacks, and all these are risk factors that can lead to death of the human being or organ damage for the human being. And it is known that during fasting, this kind of cholesterol, which we call the LDL cholesterol, reduces significantly. Therefore, it reduces the risk of getting these cardiovascular diseases. Now, the other benefit that we get from fasting is that it helps to regulate our immune system. So it is known that those who fast, a lot of them do engage in eating of certain fruits around this particular time, especially during the month of Ramadan. We tend to take in a lot of fruits when we are having our iftar, and then we all know the benefit of fruit to the health of the immune system. And when we say immune system, it is like the defense system of your body that is able to fight against infections when you have those infections. So it is known that, yes, during the fasting period, because we engage in taking a lot of these fruits, then it enhances our immune system. And in fact, just staying away from food and a lot of junk food as well actually helps our immune system to become stronger so that it is able to fight infections properly. So that's the other benefit that we get from fasting. It is also known in terms of our emotional health or mental health. When we engage in fasting, it gives us some kind of hope and those who are depressed have some form of hope, because we tend to engage in a lot of dua. We tend to pray to Allah to relieve us of our problems and all sorts of things we go through in life. And it is known that during this period of fasting, a lot of people are able to cope emotionally, and it is more or less a strategy that you can use to become a better person, and then your mental health gets improved. During this fasting period too, we engage in a lot of nawafil. When I say nawafil, we engage in a lot of supplicatory prayers in the night, and these prayers are formed, even though the main aim for these prayers is to uplift us spiritually, but we tend to engage in moving up and down, and it's a form of exercise. And as you know, once you exercise, you reduce your weight, and once you reduce your weight, it also helps a lot to control our chronic diseases. So chronic diseases like hypertension, diabetes, it helps to control. Once you lose weight, it helps to control these conditions. There are some people who are already diagnosed with hypertension, diabetes, and it is known that during the fasting period, those people who are on medication, the fasting helps them to cope, and in actual fact, it helps them reduce the quantity of drugs that they are taking. So, for example, somebody is diabetic and they are taking, say, insulin injections during the fasting period, because they are not eating too much. Their sugar level tends to go down, and therefore the amount of insulin they need to inject to control their diabetes actually also goes down. And it is known that even some of the tablets that we use for controlling diabetes during the month of Ramadan, because we are not eating like the normal days, the sugar levels goes down, and therefore you may not need to take a lot of those drugs. Having said that, it is very important that those who already have these conditions would always consult their doctors before even the month of Ramadan, so that they optimize their medication for them. It is important, because if you do not go to the doctor to look at your medication and then optimize these medications, and then you go into fasting and you don't eat and inject yourself with insulin at suhoor time, you can actually go into what you call hypoglycemia, because your sugar levels might go very down, and that can lead to very detrimental effects. So the advice is that we consult our doctors already if you have been diagnosed with any of these conditions, so that the doctor can prescribe the right quantity of medication for you to be taking during the month of Ramadan, and also give you proper advice as to how to go about the fasting in the month of Ramadan. So in a nutshell, we have looked at some of the benefits that we tend to get in terms of medical benefit when we engage in the act of fasting during the month of Ramadan. And it goes to add to the body of evidence that indeed the Quran is from Allah. Allah himself said that وَأَن تَصُومُوا خَيْرٌ لَكُمْ إِن كُنتُمْ تَعْلَمُونَ. Therefore, it is one of the benefits that we get in the month of Ramadan. وصلى الله على سيدنا محمد وعلى أهل بيته الطيبين الطاهرين. اللهم صل على محمد وآل محمد.